Hi, Dr. Mark Sweeney at Austin Dental Spa. We're here to finish up on talking about teeth grinding. In part one, we talked about what are the causes of teeth grinding. Now in part two, we're going to talk about, well, what do you do about it? Well, most people, by the time they come to us, they've already noticed that their teeth are getting shorter in the front, or they're getting little chips and cracks on their front teeth, uppers and lowers. The lowers typically will show first because of the way that the teeth grind. The lower teeth are fitting into the back side of the upper teeth, so the damage to the upper teeth is on the back side, the damage to the lower teeth is on the front side, so it becomes obvious more quickly than the damage to the upper teeth. And the upper teeth are bigger and stronger, so typically the damage shows up again on the lower teeth, which are smaller with a thinner coat of enamel on them. But if you can look in your mouth and see at the top edges of your lower teeth that there's a little dark ring there with a white ring around the outside of it, that's like sawing a tree in half, where you see the bark around the outside and you see the circles on the inside that are the development of the tree as it grew. Teeth don't quite develop like that, but they've only got three layers. They've got a nerve in the center part, they've got a layer called dentin on the outside that's kind of an amber yellowish color, and then they've got the enamel on the outside, which is hopefully fairly white. If you've ground your teeth down to a point where when you look in your mouth and you see that amber color with a white ring around it, that means you've already ground all the enamel off of the top edge of your teeth. Now that's 1.5 millimeters of enamel, which is the thickness of 2 or 3 fingernails stacked on top of each other. That's a pretty significant amount of grinding. In a 70-year-old, we wouldn't be quite as concerned as if it was in a 30-year-old. What do you do about it? Well, the first thing we usually do is try to establish what's causing it, what do we do to stop the grinding before we start looking at repairing it. The most common thing in dentistry nowadays is make a night guard, a small piece of plastic that usually goes over the upper teeth, and it covers your teeth at night, so that at least if you're doing it while you're asleep at night, you're grinding on fairly inexpensive plastic that's easy to replace, rather than continuing to tear down your original tooth structure. So for most people, that is enough by itself to stop the damage. Then we can look at repairing it. Our first goal is usually to put back what got worn away. We can go in with the newer filling materials that are tooth colored. We can match the color of your enamel exactly, and we can go in and fill that area in with filling material that's going to be much stronger than that inner layer of tooth structure. Not quite as strong as your enamel, but we're getting there. So that's usually our first line of defense, is build it back up with filling material and see how long it lasts. I've got some patients that we did that to 10 years ago, and they're still functioning fine. Maybe they've worn the filling material a little bit, but once they wear it all down, they're back to where they were 10 years before. We build more filling material up. If 6 months later they're chipping or grinding that away, then we know we're going to have to go to a stronger material like porcelain. It gets even more complicated if you look at your face and you notice that the lines from here to here have gotten more pronounced than you think they should be at your age. A dermatologist might be on your list, but a dentist needs to be on your list too, because that typically means that your nose and your chin have gotten closer together as you've ground the teeth down. You're not only grinding the teeth in the front, you're grinding your teeth down in the back. And so that can cause some damage. It can cause jaw joint problems. It can cause sensitivity in your teeth ultimately, and it needs to be repaired. Typically, when it's whole scale damage like that, everything needs to be built back up with porcelain, not with composite material, because the bonding just won't hold up under that amount of pressure. So if you've got that kind of issue, you really need to see a dentist that knows how to treat those kind of issues. The good news, once it's treated, you're going to look at least 20 years younger.